Good to have you back to the John Frederick Show, Common Sense for the Commonwealth, where we're broadcasting from the nation's capital. This is Virginia's only statewide radio network. We are the voice of the Commonwealth. Joining us now is State Senator from the 6th District of Virginia, Ralph Northam. He's a Democrat. He's also one of two candidates running for the Democratic nomination for Lieutenant Governor. That will be decided in a Democratic open primary on June 11th. Open means if you are a registered voter in Virginia and you want to participate, you can just walk in, show your credentials, and you can vote in that Democratic primary, as I will.
And two important points about State Senator Northam. One, he has promised to pick you up and take you to the polls. And secondly...
my whole family.
Exactly. And secondly, he's a baby doctor.
That's right.
Perfect person to talk to about the expansion or contraction of Medicare and Medicaid.
Senator, great to have you with us.
I appreciate the opportunity to be there. How are you all doing today?
We're doing fine. Hey, we didn't catch you at the Conservative Political Action Conference. Next time, if you get elected Lieutenant Governor, I'm going to personally invite you to next year's CPAC. You'd have a good time.
Yes, sir. I really appreciate that, and I'll be looking forward to it.
Okay, let's go right to Virginia Medicaid, if you will. Speaker of the House of Delegates, William Howe, came out with an op-ed the other day saying expanding Medicaid in Virginia is a bad idea. Basically, he said it's a broken system. Why would you want to expand something that doesn't work? And he's also saying that it can't be paid for at the end of the day. How do you respond to that?
John, I have a tremendous amount of respect for the Speaker. We work closely together up there in Richmond. We've been able to get some good things done, but I think he's a little bit off the mark. And I think a couple points we need to make. One, this is about quality of care for hardworking Virginians that, their salaries haven't kept up with the cost of health care. The other thing that we need to look at, the Medicaid expansion as it's set up through the Affordable Care Act is an economic driver for Virginia. I mean, this is money that's available to the Commonwealth of Virginia, and if we don't take advantage of it, other surrounding states are. I mean, for example, Delaware, Maryland, New Jersey, Kentucky, all of these states have opted to take advantage of the expansion, and this puts our hospitals and our providers at a tremendous economic disadvantage if we don't take them up on the expansion. So those are 2 points that I would look at. The other thing that I'm a veteran, an Army veteran, and I find it a little bit offensive to call these folks that are eligible for expansion poor Virginians. Over 30,000 of these, John, are military veterans. There are service members that are coming home from Iraq, from Afghanistan. They have fought for our freedoms, and to call them poor Virginians, they're merely Virginians who are hardworking, that again don't have the money to pay for coverage. That includes for themselves and their families. And I think the least that we can do to thank them for what they've done is to offer them health insurance. So I admire the Speaker, but I think he's off the mark. The other thing I would say, put yourself in the position of a CEO of a hospital. When these folks come, when I say these folks that don't have insurance, when they show up in our emergency rooms and end up in our ICUs, the hospitals, they have to eat that expense, and that expense is passed on to people with premiums. So we're all paying for it, and again, for the quality of care for these individuals and for the economic driver of Virginia, I think we've really just, those that don't want to expand Medicaid kind of have their heads in the sand and aren't looking at the big picture.
Well, there's no doubt that the aspect of the billions of dollars spent by hospitals basically in providing indigent care, that gets passed on to everybody. That's one of the big problems we are grappling with in the system. But Senator, what about the argument that basically the federal government is saying, well, we're going to fund this for a period of time. It's billions of dollars. And then there's a fear that, well, eventually the federal government is not going to be able to keep funding it because they're already $17 trillion in debt. And that if we go down this path, then at some point it's going to get turned over to the states, and the states can't fund it. And then what happens?
Yeah, no, I think that's a great question, John, and something that we need to talk about. It's kind of to take that position. You're betting against the United States of America. We are glad to accept money for transportation. We're glad to accept money for education. And what happens is if it gets to a point where the federal government isn't able to fund it, we can opt out. I mean, that's clear in the Affordable Care Act. The other point I would make, John, is that the only way to address costs, and it's the cost of health care that's driving this Commonwealth and driving this nation to its knees, but the only way to address that is to provide coverage. And once you have coverage for people, then they have a primary care doctor, they have preventive care. They're not receiving their care in the emergency room in what I call a crash and burn way of providing medical care. So that, and we've done a great job in Virginia. I mean, talk to Bill Hazel, the Secretary of Health, talk to a lot of other Republicans. We have changed from what we call a straight Medicaid to a managed care Medicaid. We have saved the Commonwealth a significant amount of money. And, part of this whole program, John, that I think gets lost sometime, and all of us tend to agree on, we need reform. And that's part of it. And, the way we have, one of the biggest steps, the way we've reformed Medicaid is through managed care. We've gone almost toward 100% managed care, and again, saved the Commonwealth a lot of money, and also provided better quality for these people that have Medicaid. So, I don't buy that argument.
Senator Northam, what about the fact that under the Affordable Health Care Act, Obamacare, if you will, that those people that are uninsured right now, like those 30,000 veterans that you mentioned, they're going to be required to buy health insurance under either the state or, in our case, in Virginia, the federal exchange, or they're going to get penalized. So kind of the system that Obama has put in is going to make them buy insurance anyway. So then why do we have to expand Medicare?
Well, John, that is another great point you bring up, and a disappointment that I have. Last year, I introduced legislation for a state-run exchange. Again, an option that we had. I hear people say that we want less federal government, we want less regulations. Well, what an opportunity we had last year to design an exchange for the Commonwealth of Virginia that would be in our best interest. We designed it, we wrapped it up in a box with a bow on it, and it's sitting on the shelf collecting dust, and we've turned that back over to the federal government. So, I hear what you're saying, but again, we have an opportunity to take control of this in the Commonwealth, and I think just by playing politics, some folks have lost that opportunity.
Dr. Northam, I would ask you two key questions. Part of this goes to the business of medicine, but Medicaid doesn't offer long-term wellness and coordinated care options, so it doesn't encourage healthy lifestyles, which, as we know, would significantly reduce the cost of the program. How do you address that with modifications of the program?
Well, I don't know where you're getting that information from. Let me brag a little bit on a Fortune 500 company in the Commonwealth of Virginia, Amerigroup. And Amerigroup has developed their business by managing Medicaid. And if there's anybody out there that thinks that managed care has not improved the quality of life for Virginians and decreased costs for Virginia, they're wrong, and they need to go by and take a tour and see what they do. But when you talk about long-term care, that's what they're about. They're about making sure that people have a primary care doctor, that they are making their appointments, that they're taking their medicines, they're having their blood pressure checked, they're preventing things like type 2 diabetes, coronary artery disease. John, that is what it's all about when you talk about, saving costs to the Commonwealth of Virginia. So, we have changed from what we call straight Medicaid to managed care Medicaid, and have improved the quality of life for many Virginians and have saved the Commonwealth a lot of money. And we can continue on that path. That's what reform is all about. We also, as part of reform, need to, make our patients more responsible for their care, make them, choose healthy lifestyles, decrease cigarette smoking, decrease alcohol, good nutrition. All of those things are long-term care, and at the end of the day, they save us money. It's the old saying, an ounce of prevention is worth a pound of cure, and there's a lot to be said about that.
I am very familiar with AmeriCare, sir. I actually use it myself, but again, that is a private company that deals with the management of Medicaid, and I would ask you again about the business of medicine. Medicaid pays doctors so little that many physicians refuse to see Medicaid patients, as was noted in Speaker Howell's op-ed piece. And I would ask you how we can adjust those payments so that people are not leaving the medicine field as both doctors and care providers and nurses and so forth.
Great question. And, the Medicaid expenditures, let me just, give you an example. Mm-hmm. Children's Hospital, where I work in Northam, 55% of the patients that come in the doors of King's Daughters Hospital are Medicaid. So, and you're exactly right. We're 47th in the country as far as reimbursement. And so, one of the biggest problems with what's going on with the Affordable Care Act and the expansion, if we don't take it, is called DISH. And I'm sure you're familiar with that. That's disproportionate share for hospitals. Mm-hmm. King's Daughters, an example, would lose $18 million a year. University of Virginia Healthcare would lose $49 million a year. Again, if we send that money to other states, that is a tremendous burden on the hospital care systems in Virginia.
Dr. Northam, I would ask you, since you are one of the physicians who serves in the state Senate, along with over on the House side, Vice Chair of the Health, Welfare, and Institutions Committee, Delegate John O'Banion, who is a neurologist, I would ask if you would participate in Speaker Howell's newly formed Medicaid Innovation and Reform Commission to help oversee the implementation of the reforms that would help the future of Medicaid in this state.
Yes, sir, I'd be glad to. And, I have a tremendous amount of respect for John O'Banion. Interestingly, mm-hmm. He's an adult neurologist. I'm a pediatric neurologist. But, anything that healthcare providers can do to work with, Secretary of Health Bill Hazel, Commissioner of Health Cindy Romero, we have some great people there. We just need to sit down at the table and, let people that have experience in healthcare put Virginia in the best possible posture so that we can provide good health care to all Virginians.
We will pass that on to Delegate O'Banion, who will appear on the program tomorrow, by the way, sir. John?
Senator Northam, let's get to the transportation package that is now being reviewed by Governor McDonnell. First of all, we want to commend you for voting in favor of it. We absolutely think it was the right thing to do. Is there a particular amendment that you think the governor should make, or you in favor of Governor McDonnell just signing it like it is so he's not opening up a can of worms?
Well, that's I appreciate that question. And, what a tremendous package and a bipartisan, effort to make a change in transportation, really with no changes since 1986. It puts, about $1.3 billion of revenue on the table that we haven't had up until now. I don't have any problems at all, John, if he signs it as is. I think that may be the best way to go. If I could offer any advice, one of the things that does bother me a bit is the $100 fee on hybrids. I think it sends the wrong message from right. Virginia. We need to be good stewards of our environment. I think we need to leave a smaller carbon footprint, on our environment for our kids and their kids. So, again, to disincentivize people to drive, high energy or efficiency vehicles, I think gives the wrong message. So it would be great, I think, if he could, get rid of that part of it. But at the end of the day, it's all about compromise in Richmond, John. And again, it's a package that we desperately need. Or, in order to attract jobs and businesses to the Commonwealth, we have to take care of our transportation and infrastructure. Our roads are pitiful; they're embarrassing.
Yes.
So this is necessary revenue, and I would hope that the governor would would move forward with it.
And we're with Senator Ralph Northam. He's also a candidate for Lieutenant Governor on the Democratic side. Senator, we've only got about a minute. Tell us really right now the major thing that distinguishes yourself from Anish Chopra.
Great question. I think it's all about experience, John. I've been in the Senate for 6 years now. I know the players. I've made the relationships. I know how to get things done in the Senate. I've run in 2 competitive races. So I think that's the main thing right now is experience between the 2 of us. He's a good person, and his intentions are good, but we need someone that can preside over the Senate and look at the issues that are important to the Commonwealth and move the Commonwealth in a positive direction. It'll really be in the interest of everybody.
Senator Miller from the 1st District said he was going to personally hammer some signs up for you. Have you seen any evidence so far of that?
We're on our way to Roanoke. We just passed through Newport News, and I could have sworn I saw Senator Miller out there with a hammer in his hand this morning. So we were going fairly fast, but I think it was him.
Was he singing that old Trini Lopez song, If I Had a Hammer, by any chance?
It looked as if he was, yes, sir.
All right. State Senator Northam, we hope to have you back on to talk about your campaign as things move forward. Is that agreeable to you sometime in the next couple of weeks?
That's great. We're excited about our campaign. We've got a great team. We've got a positive message for the Commonwealth. And, still, John, my offer is good to pick you up on Election Day. I can tell you my vehicle's probably not as fancy as those of yours to driving in, but we'll get you to the polls. I can promise you that.
Hey, we're in media.
Yeah, we're not making it. We're breaking it. A very quick technical question. On the show yesterday, during Governor McDonald's interview, he said that the only thing they really had to look at in that transportation bill were a few technical issues. Are you still supportive of trying to get that through both houses on April 3rd, even if there are minor tweaks that have to be looked at?
Well, obviously, I wanted to see what his minor tweaks are, but again, I think that if he keeps the package pretty much intact, then I'm going to be very supportive of it.
Terrific. Thank you so much for being on with John and I this morning. State Senator Ralph Northam, who is also a physician, on to talk about not only transportation, but the all-important Medicaid expansion, here in the Commonwealth. Thank you so much for being with us, Senator, and we look forward to talking to you again.
Thank you. You all have a great day.